listen. It's been a long time. Now everybody gonna play my funk. See your mama, come on, move that junk. Yup, Southside going pop trunk. Coming down with my swag in the punk. Old school gon' feel this track. Yup.
All right. Hey guys, and welcome to the Nostra podcast. I am back again with another installment of COVID and the community, and I brought back two of our most popular guests to our show, Dr. Robin Moore and Dr. Joanna Fields Gilmore, and we're going to just try to provide an update from our last discussion on COVID. Some things have changed since maybe the last 6 or 7 months since we talked about COVID. And we just want to provide the community with some updates. So first I want to say welcome to my guest. Thank you guys for joining us, and thank you for your time, sharing your time today with us, and to get the word out to the community. So without further ado, I'm going to jump into my first question. It's been a while. We've been dealing with COVID now for the last couple of years, since 2020. And based on the things that we talked about in the last interview I did with you ladies, the vaccines were just really kind of coming out, and so we didn't know what to expect from the vaccine. So can you guys just share with us your experience on the vaccines that you may have taken, or the most popular ones that you've given to your patients, or what the feedback that you've heard from your patients, or the ones that are maybe the most effective, or the ones that the people like the most. So I know that was a lot to digest, but just understand what I'm trying to say. So I don't know who wants to jump in there, but Dr. Moore, you want to say?
I got the Pfizer.
Oh, okay, go ahead, Dr. Gilmore.
And I got it in December of 2020. And then the second one was like late January, or not too long after that. And then I got my booster, and I think I got my booster in August. So Pfizer the whole way. My experience was first time when after the second shot I had muscle aches and pains. And it was kind of like when you worked out too hard or too long. And then when I got the booster really knocked me down for a couple of days, and I had some residual stuff for about a week, like a little bit of nausea, muscle aches and pains. But yeah, so I got Pfizer.
Okay, the Pfizer one. Okay.
I got Moderna. That was the one that was available to me. I too got it in December 2020, and then second one January. And I just got my booster 2 days ago. Sore arm. I'm really a little nauseous this morning, but I'm good now. A little better. The effectiveness reportedly is a little bit better with Moderna, especially against the Delta variant. We're unsure with the new variant. Patients those that are getting it are relieved that they have it. I don't have too many that have been reinfected. Those that have, they had really a mild course of symptoms. So it's not to say that you won't get it, but we want to decrease hospitalization, fatalities, and serious illness.
Now that's one thing I can say, that and I don't know, it could be you know how y'all guys know how I am, the media, but you don't see the, oh wow, the numbers, and then and this the refrigerator trucks backed up to the hospitals and stuff like that. You just don't see a lot of that's going on in the news, and I'm obviously that's part contributed to the fact that people are getting vaccinated and things of that nature. So that definitely speaks to getting the vaccine, for those who still may be on the fence about the vaccine, or waiting around to kind of see the effectiveness. I, being one of them, still is waiting around, and there's no reason I'm just going to put it out there, just for everybody, that there's no reason to wait around. I'm not a anti-vaxxer or anything of that nature. It's no real particular reason. I've educated myself enough on the different vaccine types. I know that there's no little miniature robots. Well, I don't know, but I mean, I've educated myself on the vaccine, that there's no little minor micro robots or things that's in that, or baby parts and things that people would scan a lot of people. So it's just a matter of just getting to it and getting it done. But just, I will throw out there.
They don't trust the government right now. So a lot of people just don't trust. It's a trust factor. They don't trust the government. They feel like it was rushed, and just don't believe.
Right.
That's what it kind of boils down to me.
And I think with me is,
but
like you say,
the disease, vaccines work.
Say again. Sorry.
I'm saying vaccines work. Eradicate disease. Vaccines work if we have enough people to take it.
Right.
So we're always going to have variants. It's a virus. It's going to mutate. We don't have enough people getting vaccinated at the same time to get it ahead of it.
Right. And well, that's actually a good segue, Dr. Moore, into the next thing I want to talk about, was variants. And we have, since the last time we talked, obviously COVID-19 was a monster. Then we got hit with a back-to-back monster with the Delta variant of that. It was, the mutation of that disease, and then into something else that was even worse, more was it communicable, like spread through the air. And then now since then, we've we're on the just the very early start of this, which is the Omnicron variant. So I guess, can you just tell the people who might not know, like, why does this thing, if they don't know much about why a virus mutates and the reason why this thing is mutating, and we can't really kind of get our arms around it, for those that may not understand, why viruses do what they do?
I don't really know how to answer. I mean, viruses they just mutate. You're just going to have different strains until we contain it. Just like the flu, we have a different strain every year. You're going to have different strains, and different effectiveness and different courses of action with each strain, like Omicron. So we've had several in between there that you didn't hear much about because they kind of died off and weren't as virulent. But viruses just mutate, period.
Okay. What makes Omicron so different? Don't we get new COVID strains like all the time? So what makes this one any different than the next one, and then maybe different than the next one that comes out after Omicron? Just the nature of.
When it comes to the variants, it's because of the way COVID was handled from the very beginning, that when there's like a new strain that comes out, it's especially like the Delta and now the Omicron, it's important for everybody to know, but it's just the way that everything was handled from the very beginning. And so now when something comes out, it's it's ultra scary, which it is. I did a little bit of reading about the Omicron, and from what I could see from the cases in South Africa where it first showed up, the disease is manifesting milder than the Delta variant. They're not sure if if the booster covers Omicron, but those patients who have cases in America now, we've got about 32 cases from the last thing I read in 12 states across the country. They're in the Northeast, 7 cases are in California. It's mild, very mild in those patients who've been vaccinated and who have their boosters. Those patients who have not been vaccinated are showing signs of fever, like a dry cough, scratchy throat, and muscle aches and pains. But the manifestation or the presenting symptoms of the patients has not been shown to be as bad as Delta.
Okay.
from what I read.
Well, that's actually promising, and that's very good news. Did you want to add anything to that, Robin? Do you have anything to add to that?
No, pretty much the same. I read that too. It's not as bad as the Delta variant, but it's early. If we can contain it, it's only in 12 states right now, but it's early. Because I know the person in California, they had traveled to South Africa a month before they tested positive. That's a lot of days to be around people who are possibly infected that we just may not know yet.
Right. And then everybody's back in the air again, right? Everybody's traveling, moving around.
Exactly. So it's a wait and see to me, wait and see, and hoping that these boosters and what we've been vaccinated with will cover that variant. And hopefully that'll get people to get vaccinated.
Right. And again, let me just tell my audience too, and like I said, again, I want to thank you ladies for coming on talking about these things because, and I'm kind of putting you guys on the spot because we don't know a lot. There's a lot of things that are unanswered. So I appreciate you guys giving your subject matter experience basically and opinions on this when there are so many unknowns, with the new strains and stuff like that. This next question is for Dr. Fields Gilmore, more specifically, and Dr. Moore, you can chime in as well based on your experiences. But since you have a younger a child, Dr. Fields Gilmore, what are some of the concerns or some of the things that you may have talked about with your family about with you having a young son? And Dr. Moore, you also have younger family members as well that are in that wheelhouse of adolescents or preteens. So what's been some of the discussions, in y'all family about, with respect to the COVID and getting shot and things like
I mean, he's in school. He's in toddler school or preschool, and I've had to test him a couple of times. And because of his age, turning 2, there's no vaccine for him.
Okay.
And so just being vigilant, paying attention to the signs and symptoms, and if gotta test him, then test him, and hopefully he'll be okay. But I mean, I try to limit the amount of exposure that he has when he's not in school. But the thing about being in school, because I have to work, so the thing about being in school is, you can't really control the other little kids and their families and things like that. So he's got to pray and cover him and pray of him every day, and just be responsible and be responsive to any signs or symptoms, not just be like, oh, it's just a cough, that kind of thing. So.
Yeah. How about you, Robin, with having a younger family member, and the things that y'all may have talked about?
My niece is of age, not vaccinated yet. I wanted to take this weekend, but my brother is out of town, so I figured I better get the consent of a parent. I did talk to him about it, and he's not vaccinated, and he was opposed because before he was like, wait until it's approved. Well, it's been approved. He has MS, so he's concerned about whether he has, whether or not to take it, if it's gonna flare up something for him. And my argument to him is she's exposed more because she's in school. So it wasn't a no, because she's going to be vaccinated, but with or without his consent, because they don't ask. But he was like, talk about it. So it's not closed off. I'm like, I just need to probably tell him more reasons why. And I think people get in the uproar because when they feel like you're being told what to do, that's when they start resisting. When we've been vaccinated all our lives and it was not an issue. Now it's all political and it's an issue.
Yeah, it's an issue.
I think when you just explain to people why it's important, I think they're a little bit more amenable to it.
Right.
What I wonder is, because I don't know how life was when the flu shot came out. Did this happen with the flu shot? Because I would imagine that as human beings, this type of response to something new that you have to get injected with is probably part of the course. I'm thinking, and you got a lot of people, because even to this day, you got a lot of people who will not get the flu shot. because they believe that you get the flu shot, you're going to get the flu.
Mm.
Or that, you know, they've been kind of giving misinformation about how the flu shot works. So, you know, I mean,
No. Well, actually, Dr. Phil, that's actually a really good point, and then you jog my memory on something, because I was talking to just a friend of mine, and one of their things about the whole deal about getting the vaccine and all that, and correct me if I'm getting the details wrong, so for my audience, but with the trials with the vaccines and stuff, was this like the one where they didn't do a live stream, like you're saying to the flu? Didn't back in the day they used to give you a strain of the flu, but like the thing with this one, they don't give you, with the COVID, they don't give you a live strain. So I think that's a lot of where a lot of people were getting a lot of pushback. Am I off track on that, or do I know what I'm talking about?
I think so. I think you're right. I think you're spot on. Yes, because I remember even before I even got into med school, I learned when I was getting my public health degree that you couldn't give certain vaccines to pregnant women because they were live strains.
Right.
As far as the flu, they changed that though. I don't think there's any more live strain flus, but I could be wrong. I mean, in America, I don't know about around the world.
Yeah, and that was like some, I got my buddies who are, conspiracy theorists and all that, and it was like, well, this one didn't do the live strain, so that's why you shouldn't take it, because blah blah blah,
right.
Like the flu,
giving it to you, no.
Yeah, exactly.
Well, that's actually segues into another question I have. I follow sometimes and watch the podcast, Joe Rogan's podcast. And if you not familiar with Joe Rogan, he does a podcast. He talks about a whole bunch of different things. And one thing that he was recently famous for talking about is he took the ivermectin, if I'm saying it correctly. And he was saying how it was being politicized by the left, and they were saying you can't take that, but he took it and he turned out fine. Just like politicizing it earlier, a year or so, a year and a half ago, with the right talking about hydroxychloroquine. What do we know about these two? What's the latest on hydroxychloroquine that everybody was talking about? You could take that one, and no, don't take it. And ivermectin, and Joe Rogan took this and he's fine. So do you guys have any inputs or any thoughts on what you've seen or heard, being that y'all are right there on the forefront?
I don't recommend it. It's nothing proven, and I really don't hear about hydroxychloroquine for that much at all. I don't know about you, Joanna. Some people have asked me for ivermectin, and I just said no. I mean, there's not enough literature to say that's what we should use. So I don't recommend it. I don't prescribe it. And tell them, when they ask for it, just no.
But do you have anything that you guys, I mean, like I said, y'all read these trials, y'all read a lot of stuff, anything that's saying about it? Nothing?
Nothing is saying that
it sometimes, and sometimes it don't.
I mean, some people not as sick either. It just varies. Some people don't need anything. I tell them to take zinc, vitamin D, and vitamin C. That is it. And hydrate, period.
That's right. Take a lot of zinc and vitamin C.
Those three, and hydrate. That is all I tell people to do, unless they are short of breath. Then I tell them to go to the hospital, unless you need oxygen. But there is nothing that has shown that ivermectin has made a difference. Now, why those people felt better, they probably were going to feel better anyway. In my opinion, I don't think the medicine did anything.
And Joe Rogan, he's pretty good shape. He's an MMA fighter, sometimes, and does this and that. So I don't know if that has anything to do with it as well. So, okay. So anything on that, Joanna? Did you have anything to add on any of that stuff that you may have heard from those?
I've had a couple of patients ask me for ivermectin, and I can't prescribe it anyway. But
right. Okay. And what is it like for parasites or something? Is that the But wasn't the hydroxychloroquine for parasites as well too? Or
hydroxychloroquine is used
mosquitoes or malaria, wasn't it? No.
It's got a couple of
autoimmune diseases.
Autoimmune.
Oh, okay.
For like rheumatoid arthritis type patients, lupus, that type of thing. That's the common use in America. It has other uses. But yeah, with the ivermectin, I think they use it in livestock, don't they? Don't they use it in cows?
Yeah, I thought it was something
And
like.
Horses?
yeah, horses, yes.
Wow. Okay. All right.
Right.
Um. Um. If you have you heard of anybody? You guys were talking about the vaccines and booster shots a little bit earlier. Can you mix and match booster shots? I think some people are asking that
I
question.
think they were saying in the
And
beginning you could.
yeah, they're
Okay.
saying you can now. I didn't mix because Moderna has been shown to be a little bit more effective, so I stayed with
You
that.
stuck with it.
And they're
Okay.
both similar types. I think the most benefit is probably those that got the J&J for them to get
Yeah.
the mRNA. But I
Well,
don't know. And did you mix, Joanna? Did you
No,
mix
I
yours?
got Pfizer all the way. I got the Pfizer
But they're
booster
saying you
too.
can.
So
They're saying you can.
yeah, they're saying you can.
okay. Okay.
And I
Otherwise,
thought about it. It may cover all my bases, maybe, because this one Pfizer may shown to be more effective against Omicron, but I just end up sticking with what I had.
I think it's at the end of the day when you're talking or saying okay the percentages of whether or not it's they do have the data to show that the Moderna is shown to be more effective, especially with the Delta variant. However, at the end of the day, you got the vaccine, you get the booster when you can, and then you still do the same stuff that you're supposed to be doing in the first place. You keep your mask on,
Mm-hmm.
you wash your hands, you don't be up in people's faces, and that type of thing. So it's not like, I've got the booster and so now I'm reckless.
Right.
right.
You don't let your
So yeah, don't let your guard down and all that jazz. And if you
And
don't feel good, then stay home and try to get tested and
no,
and
absolutely.
do what you need to do.
No, absolutely. I agree with that. I don't have the shot, but I'm still not out here. And it's funny because I laugh with people all the time because I don't have a shot, but I still, wear my mask, washing my hands up. I mean, I was gonna do that regardless. But it's funny, I walk into places and everybody's looking at me crazy because I'm the only fool in there with a mask on. So everybody else is just out there. It's like they like looking at me like, oh,
let
look
them
at
look
him, he's got a mask
what?
on. Huh?
Yeah, and what? Yeah. Let
Yeah.
them look.
So
Let them.
yeah, no, and I'm like, yeah, I'm still not talking. It's like, why you have that mask on? So all good, all good. Actually, ladies, that took me through a bunch of the questions that I had already. Did you guys have anything that we probably didn't touch on that you want to talk about, get out there to the community, or anything that you wanted to say as a wrap
Yeah.
up? Yeah.
No, I want to ask someone who is unvaccinated. You said there's no reason, but there's something. There's something that's stopping you. Like,
Right.
what is it?
So
Because other people may
right.
be feeling the same way. So,
No. There's
what is
it,
your
and I
hesitation? What is it?
and I received that. I received that, and this is so for me. You hit actually on it. You hit it on the head earlier. It's a trust thing for me. I have to actually do
Okay.
my due diligence and really want to sit back and see. Like I said, I'm not an anti-vaxxer. That is not why I'm not doing this at all. I'm still at a wait and see point.
Okay.
I was gonna do it probably about a month ago, and I talked it over with my sister, and so we were going to wait to Thanksgiving because I went to visit my sister for Thanksgiving, and we were all going to do it on Thanksgiving, and then something happened, and we didn't end up going. So we have it on the plan. I just as of December the 5th, I haven't taken it yet, and it has nothing to do with like I said, I did have some concerns. Yeah, government. Yeah, all that, the trust, what's in
I mean,
it.
I have concerns too.
Right. And what's in it? I didn't know what was in it. What are you giving me? And the rush, all those things were key factors and contributors to why I have held out as long as I have. So that's my reasoning
I mean,
behind
it's
it. But
valid. I mean, I honestly had concerns too. I was first. I didn't want to be the first one, but
right,
when I really looked at the numbers and you weighed it, people were
right.
dying.
Yeah.
Dying. We're
No.
almost up to 1 million people.
Well, and to your point,
So I was.
since our last conversation, I've lost my grandmother. Since our last Zoom that we had on this. Even though it wasn't COVID per se, she had pneumonia, which was related to COVID like symptoms. So that took her.
Sorry.
And the crazy part about it, she was 93, 94. She wasn't nowhere close to dying. Like she wasn't nowhere near that. Like she was strong. She was still strong, still, my grandmother. And, it just was unfortunate that we think some family members had it and then passed it along to her, unfortunately. And then I've had an uncle that went through it, had it, was on the, like a portable breathing machine. So I firsthand have knowledge how real it is. And even though in the face of that, I still have my concerns, right? So that to me, my mind are real and valid, right? So even in the face of all of that. So.
And that's even a point
about your grandmother's passing.
I'm not badgering you, but you get it for your family members.
Right, you get it for other people. And I've always been the one like, well, I don't want to. I'm sorry, go ahead, Robin. I stepped on you. Go ahead, Robin. I'm sorry.
Go ahead.
No, I was just saying, no, I totally am with. That's why when I'm out in public, I wear my mask, I'm washing my hands, I do the fist bump, and all that, the elbow bump, so I'm all, with that. And I understand that getting it is for the other person. And I have enough, it's funny to say that I have enough sense and I haven't gotten it, but I do understand the importance of doing it for your fellow man. A lot of people are very selfish, and some people may say that I'm being selfish, but I don't look at it like that, because I do understand the importance of getting it for your fellow man. I'm not one of those people who's like, why should I get it? It's just I haven't done it yet to this point.
Okay.
So, but no, very valid question. Thank you for asking.
Well, I was gonna say, it's on the agenda.
Pardon?
I was gonna say, I'm sorry to hear about your grandmother's passing.
Oh, thank you. Yeah, it was back in like April. It was like kind of right, not too long after we had talked, maybe a couple months after that. And like I said, she wasn't anywhere, but she was kind of in between, going from one house to the other house, and in that, transferring around, she possibly picked it up, yeah, and stuff like that. So, but yeah, and thank you for that. Appreciate that. Anything else? Anybody want to talk about anything else about misinformation, myths, work life, family, transmission, education? Anything on those fronts that you want to get out there? Okay.
Just get vaccinated. People know what to do. People know. We all know about the mask. People are not doing that. They know what to do. Yes. Get vaccinated.
They look like me. They're not just all running around crazy. So yeah, no, you're right. I do agree. Get vaccinated. And it'll make the world a better place.
Right.
And what's crazy is so the last 2 weekends I missed out on some really nice concerts because of the COVID rules and being vaccinated. So now I'm really, really like, all right, man, this is getting, everybody's getting back to normal too. So I'm a little anxious. Everybody's wheels up, everybody's traveling all over the place, and I'm still here. I ain't been nowhere in 2 years. So I'm antsy. I'm ready to get active. So having said that, any last thoughts? You guys want to IG out there or social media accounts or anything? How people can contact you? You're fine?
No.
No, not at all. I'll edit this part out.
No.
Awesome.
We don't need no strange followers, no.
I know that's right. I don't hear looking at our fly stuff. We can't have them. Hey, Dr. Girls.
All up in the DMs.
Yeah, all the old DMs. Oh man. So once again, let me just wrap it up. Thank you guys. Appreciate my audience for tuning in to the La Sofa Nostra. I hope you find some of this information helpful. And we appreciate you tuning in. Once again, thanks to my fabulous guests, Dr. Robin Moore, Dr. Joanna Fields Gilmore. We appreciate you guys' time and your expertise and getting the word out to our community. So thank you, and we appreciate
anything for you, Jermaine.
No problem. It was good. Thank you. It was good seeing you, Robin. Good seeing you again,
You
Jermaine.
too, John.
Okay, good to see you guys
Okay.
again too. Thanks for joining. I appreciate it. Bye.
Bye bye.
All right.
Peace.
Bye.
Bye.
Now everybody gonna play my funk. See your mama, come on, move that jump. Yup, Southside going pop trunk. Coming down with my swag in the pump. Old school gun feel this track. Yup.